that around 35% of our population in South Africa is fully vaccinated, around 41% partially vaccinated if you include that, but a tiny proportion of people on our continent in Africa are fully vaccinated. If we don't all get vaccinated, the chances of new variants of the disease then developing and affecting the rich world, and even those with populations fully vaccinated, will increase. Nick Dearden's the director of the organisation Global Justice Now. Nick, good afternoon to you. I mean, we keep hearing promises that it's going to be easier for the poor world or the global south to get vaccinations, and frankly, from Africa's side, it looks like the rich world's dragging its feet.
Absolutely. It's not getting there, is it? So we were told at the beginning, well, of course, the rich countries are going to vaccinate their own populations first, but don't worry, after a few months, we'll all have had our vaccinations and then the rest of the world can enjoy them. And it's just not happened. It's not happened because countries like mine are hoarding vaccinations, frankly. We're sitting on many times what we need. But it's also not happening because we now see that these things are going to be needed on a regular basis. And I think that makes the case that organizations like mine were making right from the beginning of this pandemic even more urgent, that we need to fundamentally look at the way the pharmaceutical system works, where manufacturing happens, and far better distribute that around the world, and frankly take it out of the control of the big pharmaceutical corporations that are monopolizing this vaccine knowledge, which should by rights be a public good now.
I mean, we're seeing vaccination production beginning to start here in the Eastern Cape province, in a city called Gqeberha in South Africa. I mean, this is supposed to make a big difference. In the end, I suppose it's about the number of vaccines and the price of vaccines. Those are probably the two big variables.
That's right, and I'm very pleased that more are being made in South Africa. But of course, let's not forget that at the peak of your last wave there, you were exporting some of the doses you made to highly vaccinated Europe and North America, which I think says everything you need to know about how this pandemic has been treated. It's been thrown over to the market, what we call the global marketplace, and guess what? That means the rich in the world have got way more than they need, and the poor in the world have got nothing, and South Africa is somewhere in the middle. But, as you said there, I mean, some of the neighbours of South Africa are on kind of 3% of the population. Across the whole continent, 1 in 10 health workers has been vaccinated, just 1 in 10 health workers, while people like me here are getting our third doses. I mean, it's just criminally wrong. There is a bit of hope, though. I'm really hopeful about this new facility backed by the World Health Organization in South Africa, which has just said, we've had enough of this. We're going to mimic, we're going to reverse engineer the Moderna vaccine, and we are going to give it to whoever needs it in the world, whoever can produce it safely as a public good. I think that's a real game changer. Moderna, it's shameful that Moderna and Pfizer are refusing to share their recipe with the South African government, with the WHO. I mean, for goodness sake, these companies have made tens and tens of billions of dollars on these vaccines now. They're still not prepared to share the recipes of something that was made largely with public money. But you know what? I think countries like South Africa are now just saying, forget it, we're going to do it a different way. And that really, for me, lays the path to a very, very different medical system in the future.
That may be the case. I mean, look, I completely, it's hard to argue with the morality of your argument. I do want to ask a slightly technical question around pricing, which is that a South African vaccine, so for me to get vaccinated, as I was, cost around 180 Rand, right? Now, that includes the patent. So now if you remove the patent, how much does it reduce the price by? I mean, 150 Rand, well, I mean, in the UK, that's a coffee. It's not a lot of money in sort of first world terms or in those currencies. So the point I'm trying to make is how much of a proportion of the price of that 150 South African Rand, maybe, £10 or so, how much of that is actually the patent?
So for me, it's not simply about paying for the patent. It's about the fact that the patent allows these pharmaceutical companies to control who produces, so therefore to restrict the supply artificially, which of course keeps the price very high. It also allows them to charge whatever they want. So we've worked out, just in terms of our own National Health Service, I mean, we're incredibly lucky here. All of our vaccines are free. We pay taxes for the National Health Service, and the National Health Service buys them. That's incredibly lucky, but it's cost the National Health Service way more than it needs to, because we're paying Pfizer's extraordinary prices. We reckon we've overpaid by about 2 billion. Just on the Pfizer vaccines. For people who aren't lucky enough to have an NHS, a National Health Service, they're paying that directly. And what you're looking at is many times the cost of production that you'll be paying for those vaccines, simply because the pharmaceutical companies are allowed to charge whatever the market will bear. And we know these costs are going up and up, which makes no sense, actually, in terms of how the market's supposed to work. The costs are supposed to fall as production increases around the world. It's not doing, and it's not doing because they're setting the prices. So there's no question at all you're paying many times more than you should be paying for the vaccines that you're having, simply because of the restricted supply and the control, the stranglehold that these corporations have on vaccines. Whereas, in fact, this should be public knowledge, and we should be encouraging as many factories as can safely make these vaccines to be producing them now.
I mean, it's all very short-sighted, isn't it? Every epidemiologist I've spoken to has made this point again and again and again. Until the whole world's population is vaccinated, it doesn't matter where you are, this virus is going to mutate, as we've seen.
Well, you're completely right. And this is what experts, as you say, have been warning about for months now. And when I heard the news last week, I mean, we were about to travel to the World Trade Organization in Geneva to challenge these rules. We were prevented from going. It's a huge irony that the World Trade Organization couldn't meet. And I would argue a large part of that is because of the global trade rules that are allowing these pharmaceutical companies to monopolize these vaccines. We've been arguing for months now. No one is safe until everybody's safe, precisely because even here, where some of us have had three jabs, we are going to get eventually a variant, and we hope, of course, this isn't the one that undermines our vaccine knowledge, and that means my 3 jabs are not much good. So, even from a purely selfish point of view, you're completely right. It is ridiculous for the rich world to hoard this information and this knowledge. And, we've had some great press and media coverage, and more politicians and countries coming out and say we've got to do something about this. Sadly, here in Britain, Boris Johnson's attitude to all this is, well, let's buy even more. So yesterday he bought another over 100 million vaccines. I mean, for a population of 65 million, we're already sitting on many more times than we can use. So we've donated hardly any. We've bought up all that we can grab. We've exported hardly any. And to make matters worse, the cherry on the cake, we're preventing other countries from producing the vaccines they need by upholding these intellectual property laws. It's an absolute scandal. And it's absolutely right that countries are screaming about this and saying, no, we need to do that. We need different rules. We need to do this in a different way.
Nick Dearden, Director of Global Justice now in the UK. Really do appreciate the time. Thanks very much indeed.
Pleasure.